Hello friends, welcome to our audiovisual gastroenterology channel, and I am Dr. Manoj Ghoda. In this channel, we are going to discuss various important gastroenterological problems with you in audiovisual format. Today we are going to start with one very common problem, that is abdominal pain, which is very important for any practicing physician or surgeon, let alone gastroenterologist. So abdominal pain is a nightmare sometimes to diagnose because abdomen is a small cavity. In this cavity there are various organs related to digestive system, but there are some organs related to genitourinary symptoms also, and there are some blood vessels also. So all this can go wrong in various different ways, say for example infection, inflammation, malignancy, obstruction, vascular compromise or mechanical obstruction, torsion, etc. So they're all present with different symptoms. So it becomes sometimes impossible to say what is causing the abdominal pain. So I'll give you some very important tips here. If you are looking at abdominal pain patient, listen to the patient. History. History is 95% of the problem. So if you let the patient allow to talk, if you let him choose to scan the particular catch words, patient will use certain words only from his memory. And those catch words, if you know, will directly lead you to the diagnosis. So history is very important. Let the patient talk and you just listen. Now abdominal pain have various aspects, and I will tell you what are the important aspects. One is the site of pain. Where is the pain? That is very important, and it's very easy. If you have any pain above the umbilicus, then you are dealing with probably stomach, pancreas, gallbladder, liver. These are the main organs which will give you pain above the umbilicus. If you have pain below the umbilicus, then you have bladder, you have appendix, you have rectum, colon, uterus, ovaries, and urinary tract. So these are the differences. Above the umbilicus you have certain organs, below umbilicus you have certain organs. On right and left, again, very important. All important organs are located on the right side. Talk about terminal ileum. If you talk about appendix, if you talk about liver, gallbladder, first part of duodenum, these are all located on the right side. On the left side, on the other hand, in front background you have got a ureter. So left side there are not many causes, right side all important organs are there. So this is how you can say that probably we are dealing with this organ XYZ organ as per the site of the pain. Second is the onset of the pain. So very important. Onset can be abrupt. Abrupt means 1 minute, 1 second patient was fine. Next second or within few seconds he is stuck with severe pain. Pain could be severe from beginning itself or will become severe in no time whatsoever. So that is abrupt pain. Suddenly pain takes off. That's abrupt pain. And if you have abrupt pain, then you talk about, if it is in the upper abdomen, you talk about peptic perforation. If it is in the central of abdomen, then you talk about mesenteric ischemia, mesenteric embolism. If it is lower down, you are talking about ruptured ectopic pregnancy, torsion of the ovarian cyst, or testicular torsion. So that is abrupt pain. Acute pain is the pain which will come over say a few hours, then gradually it will increase, reach a plateau, and it may subside on its own like in biliary colic or renal colic, or it will require intervention, and if you don't intervene they will develop complications. So that's your acute pain. And common examples are biliary colic, pancreatitis, acid peptic disease, renal colic, colitis. These are the few common examples for which you get acute pain. And subacute pain is that it takes several hours or a day or so before the pain reaches the plateau and may subside on its own, come up again, or if you treat it accordingly, it may disappear altogether. So that is your chronic pain. So these are two very important aspects that we have taken note of in any investigation of acute abdominal pain. Next important thing is the radiation of the pain. Where was the pain to begin with and where is it going? In a biliary colic, you have got pain in right upper quadrant, which then moves towards the right side of the chest, along the costal margin, or right shoulder, or tip of the right scapula. Renal pain will start from behind, and if it is localized, the lesion is localized to kidney only, then it will come like this towards epigastrium from behind. And if it is involving ureter, then it will go into the groin. So that is your radiation of the pain. Very, very important. This is in appendix, the pain usually starts periumbilicus region and then shifts when the parietal peritoneum is involved, it shifts towards the right iliac fossa. Other important things are associated symptoms. If you have, for example, fever and jaundice, severe fever with chills, we are talking about biliary colic, cholangitis associated with it. If you have, for example, dysuria, hematuria, burning micturition, difficulty in passing urine, you are dealing with a renal problem. If you have pancreatitis, the pain will be somewhere here and then will go straight into the back. So that is your pancreatitis. If you have pain followed by some vomiting, but vomiting is not a predominant feature, then we are dealing with appendicitis. If any young girl who has missed the period and develops sudden lower abdominal pain with hypotension, pallor, you can presume that this patient had mesenteric ischemia. If you have past history of stroke or heart disease, then probably you are dealing with mesenteric ischemia. So these are the few associated features that you may look for. And lastly, aggravating factor and relieving factor. If your pain goes worse with eating, then probably you are dealing with acid peptic pain. If your pain is relieved by passing stool, then probably you are dealing with colonic pain or probably pain of appendicitis. So these are the relieving factors in abdominal pain or aggravating factors which will lead you to the right diagnosis. So these are the main important features you look for in a case of acute abdominal pain. But remember, abdominal pain could be because of diabetic ketoacidosis. It could be myocardial infarction. It could be basal pneumonia. It could be lead poisoning. It could be acute intermittent porphyria. It could be spontaneous bacterial peritonitis. So if things don't gel very well, you have to think about these causes also. So dear friends, these are the points you may remember to ask when you are dealing with a case of acute abdominal pain.